Mannie, could you tell us a little bit about what placebo is?
The placebo is the application of a technique or a substance to a problem which has no direct bearing on the result of the solution to that problem. But in the mind of the patient, there often is a connection between the placebo and improvement.
Mm-hmm.
But are you asking that question because perhaps sometimes the osteopathic intervention may feel like a placebo?
Yes, I think that there is a large part of the osteopathic treatment which is just placebo. In other words, a part of it. So within osteopathy, there isn't one standard technique. There are a wide variety of different techniques depending on the particular approach of the osteopath. Anything from very gentle work, such as cranial work, to more aggressive work, HVT, thrusting joints, what's known as manipulation, and a wide variety of different techniques in between. And sometimes I feel when I'm about to see a patient that the technique is that the effect of the treatment is partially technique and partially placebo.
Okay. Well, one shouldn't underestimate the value or the possible value of a placebo, because alongside the technique that you're applying at that moment will be attached other elements. For instance, the patient may feel attended to, may feel cared for, may feel a sense of enjoyment from the manipulation or the massage or the touching,
or the interaction.
Yes, or the interaction. Yeah.
Is that disingenuous on behalf of the osteopath, though? Applying all kinds of techniques and claiming all sorts of benefits from certain techniques.
Well, I think the parallel with psychotherapy is what is sometimes called supportive psychotherapy, where the therapist is not aiming for huge change and doesn't expect their interpretations to lead to immediate changes, but the patient gets something out of being seen, having a regular appointment, knowing that it's coming up at a certain time. All of these elements are what we might call holding, containment, and therefore is supportive. Supportive, and nothing really dramatic needs to happen for the patient to feel supported. And I expect something similar might happen in osteopathy. There's a certain intimacy. There are questions about how the patient is, what improvements they may have felt. They feel listened to and understood, and maybe that's sufficient within a supportive, or rather sufficient in the patient's need for support, rather than a kind of treatment cure situation.
It seems like sometimes it seems like the majority of cases are like that. That it's more of a supportive type of treatment without any clear-cut orthopedic problem. And I wouldn't be surprised if doctors feel the same way, and all medical practitioners feel the same way, that a large part of what they do is just being supportive. We're lucky because we have a more amount of time with each patient.
Well, you have a fixed amount of time. That's the other important thing. It's half an hour, and that's a fixed time, and that can be very supportive. But we have a tendency to denigrate support. I mean, even the language we use is just support. But actually, it's very important for a large number of patients.
Sometimes after a session, I see my job as telling the patient what they don't have. In other words, one of the first lines I use is that the good news is we're not dealing with any kind of difficult orthopedic condition here. And often I get a response which is something like, "Oh, I feel relieved just knowing that." So sometimes, the role of the osteopath is also diagnostic, and also knowing what the patient, or explaining to the patient and allowing the patient to feel the relief of not having anything serious.
Well, indeed. And that's very important, because patients often do have anxieties that they have something seriously wrong with them. And to be reassured by a professional that there's nothing seriously wrong is often all that's needed.
One of the issues that we spoke about during the workshops was the issue of not either or, which is very often the measuring stick of traditional research methods. What is helping the patient? Is it either the technique, or is it the relationship with the practitioner? And we spoke a lot about not either or, but also
Both and.
Both and. In other words, one of the reasons why it's hard to measure the benefits of osteopathy in such a traditional way, such as double blind, is because we're not necessarily suggesting that it's either the treatment or the relationship with the practitioner. But when you come and see an osteopath, it's both the osteopath and the relationship and the techniques he uses and the setting. All of those things are being used to encourage recovery and encourage healing in the right direction.
Correct. I think that's so important, partly because the either or question comes out of the so-called evidence-based science. We need evidence to show that it's either this or it's that, and it leaves out, it ignores the holistic experience of the patient. The patient may have a pain, they may be lonely, they may be grieving, they may be on the anniversary of a death, they may be facing loss, may be troubled by in their relationships, and so on. So it doesn't take a lot of research to demonstrate, and there is a lot of research, that change comes about through the relationship. And your professional stance, your professional relationship with your patients includes a repertoire of interventions, in the osteopathic interventions and the humane, compassionate, trusting, caring relationship with your patients, which all adds up to recovery.
Have you had any thoughts on why it is that it is compassion and care and paying attention, why that might be the formula, the ingredients to a patient's recovery? Why are those particular elements? Is it anything to do with, because they obviously have a strong mirror of what a mother-infant relationship is like. So is there something about the reflection of a mother-infant relationship being expressed in the osteopathic patient relationship, which is used as a means of recovery?
Well, certainly, in all professional relationships with the caring or helping professions, there are elements of parent-child relationships. But it's dangerous to generalize too far, because it may well be that's not the real problem. The real problem may be some more contemporary event or loss, which the patient is unable to cope with. But certainly, when we go to the doctor, when you go to a lawyer, we go to an accountant, there are elements of this hierarchical authority relationship, which has got elements of parental content to it. Yeah, and same with osteopathy, but not just the same. It's even more so because the patient is horizontal. They are without most of their clothes. They put themselves literally in your hands, and that does arouse very infantile feelings of the infant being carried in the arms of the parent. Yeah, it evokes feelings, impulses, memories, desires of that sort.
And do those feelings stimulate recovery per se?
Well,
or why do they?
Well, again, it's not easy to answer because clearly a half an hour of this once a fortnight isn't going to remedy, say, a patient's inadequate experiences of mothering or fathering or parenting. Okay, so many of the patients that come your way, I expect, might have had poor upbringing.
Why'd you say that?
Well, I'm just saying that they've just taken an average number of the population. Some of your patients will come from backgrounds of serious inadequate parenting or trauma or loss, and they've coped reasonably well in their lives, or maybe they haven't, but they come to the osteopath and they're experiencing something new, which resembles the longed for caring that they may not have received.
And would you say that the lacking of that care is something that can stimulate ill health?
Well, certainly it gives rise, inadequate child-rearing practices do lead to adult problems, problems of identity, problems of self, problems of relationship. Yes, indeed. So you may find that a good proportion of your patients do come with those kinds of problems and then bring those problems into the relationship with the osteopath. And it might include the point we were talking yesterday about lack of trust. You won't be able to help me, will you? Or apply your magic. Those sorts of desires are very much based in my opinion, in early relationships.